Hello everyone. I hope each and everyone at your place is safe and doing fine. So I'm Dr. Mukesh. I have almost 10 years of experience in dermatology and I practice in Scarlet Clinic, Lajpat Nagar. Today we will understand atopic dermatitis and its management. Basically atopic dermatitis is also known as an ectopic eczema. It is a skin eczema that produces dry, itchy, scaly, dead skin and it can affect basically a age group of infants, children, adults, and they also have familial predominance. Although the cause of the atopic dermatitis is not commonly understood, but genetics appears to play a strong role, and people with a family history of atopic dermatitis, they are a more or increased risk of developing the similar condition. In most of the people with atopic dermatitis, there is a genetic abnormality in the outermost layer of the skin called epidermis. Epidermis is the first line of defense between the body and the environment. When the epidermis is intact, it keeps environmental irritants, allergens and microbes from entering the body and prevents the skin from losing too much water. In fact, people with atopic dermatitis, this barrier is basically less strong and less permeable, and it is more permeable than it should be. So basically there is a defect in the integrity of the skin in these patients. They basically have a gene mutation which is called filaggrin gene mutation, because of which they usually have less intense moisturizing factor production in the skin, leading to dryness of the skin and more cracks and more permeability than the usual or normal skin. Despite the popular belief in children that atopic dermatitis is rarely linked to food allergy, if you think that your child has food allergy, you might consult an allergic specialist for evaluation. So most of the people with atopic dermatitis develop their first symptoms during their childhood, before the age of 5. Intense itching of the skin, patches of redness, small bumps, a flakiness of the skin, dryness of the skin, constant scratching. Usually the itching worsens during the winters and there is always a itchiness. Even atopic dermatitis also have itchiness which worse at night time. Its symptoms vary from person to person, although it can change over a period of time or the duration. Even during their course, their symptoms have varied presentations. Although eczema is usually limited to specific areas of the body, it may affect multiple areas in severe cases. So in children and adults, eczema commonly affects the common areas which is involved in this group of patients is that it affects the back of the neck, elbow creases and the backs of the knee. Other affected areas may include the face, wrist and forearms. The skin may become thickened, darkened or even scarred because of repeated scratching. Scratching can lead to infection of the skins. The signs of the infection can be a pustular infection like pustules or painful red bumps which contain pus. If you think you might have an infection, you should consult your doctor and get treatment for it, because the infection can spread to other parts of the body and can lead to a lot of infection in your body and a lot of problems during the treatment and during its course. Other findings in the people with eczema can include dry, scaly skin, plucked hair follicles, usually because the hair follicles get plucked with keratotic plugs, especially raising small raised lesions or mapular lesions, bumpy lesions, which usually on the face, upper arms and thigh. Increased skin creasing on palms and soles, or there is an extra fold of skin under the eye because of constant rubbing. And around the eyes there is also darkening of the periorbital area. So these are the basic symptoms. This is called allergic shiners, and what we are there is a hyperlinearity of palms and soles which we see observed commonly in atopic dermatitis. So how do we diagnose this basically? So there is no specific test by laboratory test by which we can diagnose atopic dermatitis. This diagnosis it is a clinical diagnosis, and there is no specific test of for this disease. We usually diagnose it based upon your medical history, symptoms and physical examination. So factors that strongly suggest atopic dermatitis include long-term and recurrent itching symptoms that begin at a younger age, and a personal or family history of certain allergy conditions. Like these patients have high propensity to have some similar coexisting condition like asthma and seasonal allergies. Another factor to consider is the symptoms that get worse after exposure to certain triggers. Okay. So atopic dermatitis is a chronic condition. It typically moves from flare moves and typically improves and flare ups. Periodically, it has varied course during the whole of the season or during the overall year. So how do we treat it? Basically, many people with atopic dermatitis are initially treated by their primary care provider. However, you may need to see a dermatologist in certain situations, such as if your condition does not improve with treatment, if certain areas of your body are affected. If another condition could be, then another condition, another coexisting infection can be a cofactor in this condition. So you should always, whenever the symptoms worsen or they are not improving at a proper speed, then you have to always consult your dermatologist or go with a dermatologist, concerned dermatologist at least. So basically, you should first important factor is that we should always eliminate the triggering factors like cold or dry environment, sweating, emotional stress or anxiety, rapid temperature changes, exposure to certain chemicals or cleaning solutions, including soaps and detergents, perfumes, cosmetics, wool, synthetic fiber, dust, sands, and cigarette smoke. So basically, if we go on, if we review the atopic dermatitis treatment, the major factor is that if there is some triggering factor, you should avoid them. Okay, and use since dryness of the skin is one of the major symptoms and one of the major conditions we see on examination, so that should be improved. So people who are suffering from atopic dermatitis, they should avoid very hot or very cold bath. They should always use lukewarm water for bathing. After bathing, they should always apply a generous amount of moisturizers. Okay, coconut oil is also preferable in these patients, but they should always, and the best time to apply moisturizer is just after bath, when your skin is just dampened with water or they are soaked with water. Then you should just on that time, don't let the skin dry too much, because if it is too much dry, it will not absorb, it will not have any moisture, and in that case even the moisturizers will not help. So in that case, you even just after the bath, you can apply a whole of the moisturizers on your body. Other line of treatment, like in the itchy areas, in the areas where you have more eczematization and more that can be treated with topical corticosteroids. Okay, and oral anti-allergic drugs should also be given to this patient to combat the itching on these patients. So we always prefer this to have topical corticosteroids. In children, we usually use soft steroids, like milder steroid creams are used. Okay, the other group of drugs which are used in these patients, they are mainly topical tacrolimus or topical calcineurin inhibitors, like tacrolimus and pimecrolimus ointments are very commonly used. The other conventional treatment, which includes use of a liberal amount of moisturizers. Nowadays, for atopic dermatitis, special moisturizers are available which contain ceramides, various groups of ceramides, very commonly used, and they also provide a very good relief in these patients. And it should not be like that the patient with atopic dermatitis, that when the allergy flares up, then only you are using moisturizer. It should be a preventive thing, like in day-to-day activity you should always use a moisturizer on all over your body. So that is very important. So moisturizing your skin is the key to success in these conditions. Still, then if there's some patient, they are having recurrent conditions and they are not improving, then we also go for some allergic investigation, like IgE levels are usually done in these patients. And with IgE levels, we can think about that how why it is not going. Some people, they have very high allergic IgE levels. In them, some atopic conditions are more pre-existing, or they are coexistent with some syndromes also, which is associated with IgE, and atopic dermatitis can be a part of that. Okay, so we should always have a view if our patients are not improving. Our atopic dermatitis patient have very recurrent nature and they are not improving with some topical medications, or the usual medications are not responding. In that case, we can always consult a dermatologist, and we should always review our diagnosis and go see that what is the basic, is there is any other coexisting condition, is there any other comorbidities which we should be treated. Food allergies are, although it's not very much related to atopic dermatitis, but they can happen. So if your child is allergic to something, you can go for a food allergen test, see that whether you can basically avoid something which is not necessary to it. And it can vary from, there is no set protocol that you should avoid eggs or you should avoid non-veg. Whatever you feel like if the child is allergic to it, after that he feels more itchy on the body, then you can avoid those conditions. And the key to the treatment of this atopic dermatitis patient is just use of moisturizer, and don't keep your skin dry or your child's skin dry, and just apply moisturizers several times in the daytime, and that's how you can basically prevent it or reduce its occurrence. So basically, these are the key points in atopic dermatitis. So you follow it. Tell us if you want to. If you want to know further, you should always consult your dermatologist for further details. For further, there any for any other problematic conditions, you can always consult them. Thank you.